I really needed to go and actually see the labs and see the science. And I'm so excited to get to be spending time today with Dr. Joe Chang, who was one of the reasons that I was drawn to Nu Skin. And I was telling him a minute ago, I want to just condense his bio so that we don't spend a lot of time on it. And I can't because it's so impressive. Just to give you all some idea of who Dr. Joe Chang is, he's the Executive Vice President of Nu Skin Enterprises. He's the Chief Scientific Officer for Nu Skin and Pharmanex products. And prior to Nu Skin, he directed more than 60 scientists in drug discovery research, including research into dermatological products. And he also was in the pharmaceutical industry. He served as president and CEO of 2 privately held biotech companies. He has a doctorate in pharmacology from University of London. He was a fellow at Johns Hopkins University in pharmacology and experimental therapeutics. I'm sorry, he's a member of the New York Academy of Scientists and American Society of Pharmacology and Experimental Therapeutics. He's a prolific writer. He's written many articles, many reviews, many books on scientific research during his 18 years in the healthcare industry, probably 19 or 20 by now. Co-authored a textbook on inflammation and developed a series of monographs on botanical products to serve as a source of information for consumers and health professionals. I think one of the most impressive things prior to all that he's done with Nu Skin Pharmanex is he was responsible for the discovery of a novel anti-rejection drug called Rapamune that is derived from natural sources, and it's currently the second most prescribed drug to prevent organ rejection. So Dr. Chang's not your ordinary PhD. He is exceptional in the world of science. And I know a lot of you are really excited about the product we're going to discuss. We've been talking about it for a long time. I know, Joe, you've been thinking about it for a long time, and it's been formulating. And I've never been with Nu Skin when there was more excitement about a product launch. And so if you would give us, just so you know, this call is for North America, South America, Europe. There's a lot of people on. And so we're going to be able to kind of differentiate, because different markets, we can make different claims about this product. So Joe, I would love for you to come on and spend some time giving us a little bit about the history of why you wanted to develop this product, what the importance of it is, some of the benefits, and we can go into all the things. So if you would go, less from me, more from you. And you're muted, so I'm sure you were saying something critical.
Yep. I'm sorry. No. I was just saying we'll treat this as a conversation and a chat, right? So
Perfect.
as we go through, we just don't want to do a formal presentation from my side. And sort of a discussion format might be actually a bit more productive for many of the folks here. And we're already starting to get questions, which I sort of assume when these questions are coming through that the WellSpa is available in Europe. And I noticed some of them are also Asian. So looking at the names, it seems like there's some folks from Korea as well and so on. But anyway, I'm just going to assume that that people have heard a little bit about this device, but I will sort of give you a little bit of perspective of how we came about developing this particular product. It is interesting with your introduction when it reminds me, more than 20 years ago, that's when I was one of the co-founders of Pharmanex, and more than 20 years ago in 1998, that was when Pharmanex came together with Nu Skin, and sort of joined and it sort of merged together as one company. And it's always struck me as sort of an interesting, because when I looked at Nu Skin, why and the reason why they actually were so interested in acquiring Pharmanex was because of this possibility, the future potential, how we can actually integrate, the skin health together with wellness, the internal health, I will call it, right? And at that time, when they were looking at it, it was really more of a vision, and it was more or less something sort of a glint in our eyes, and we're never quite sure how we can actually execute on that concept. So, and on the scientific side, and then I was looking at it and I'm saying, gee, yeah, we're the only company, frankly, where we have a lot of extensive knowledge of skincare. We have a whole bunch of products we've developed looking at bringing benefits to the skin. And then now with the acquisition of Pharmanex 20 years ago, we have also created and developed a whole bunch of products for better nutrition inside the body. And I would challenge everybody on this call to sort of really look extensively, at our competitors and so on. I doubt you can find another company that has that equally robust skincare line that is so intimately connected to a nutritional supplement category or product line, right? Usually, typically, you're strong in one, but not in the others, and vice versa. And Nu Skin has achieved a status right now where we really have two. I mean, if you just look at our revenue as a metric, you can see 50% of our revenue comes from the Pharmanex nutrition products, and then the other remaining 50% comes from the Nu Skin kind of skincare products. So it's very nicely balanced. So, and our vision now going forward is that we have indeed become a truly integrated beauty and wellness company. That really, for all intents and purposes, it's really what we have become and evolved into. Now, so this idea, when I was looking at the skin, right, as soon as I joined Nu Skin 20 years ago, I said, well, one day we'll be able to do it because after all, the skin is part and parcel of the body, right? I think we all appreciate the fact that the skin, when we look at it, is on the outside, but really, when you sort of look at the science and how it is part of the body, it is in fact the largest organ of the body, except it just spread throughout the whole body, right? You don't really see that. But you aggregate it together, it is the largest organ in our body. So when you manipulate that, the concept therefore becomes, I say, well, we're doing a lot of stuff on the skin. And somehow, if we're bringing benefits to the skin, surely by manipulating the skin, we can also manipulate what's underneath the skin. Okay? Because the skin is connected to the muscle and connected to a system, which I will talk about very soon, very close to each other. They're intimately connected. So when you're manipulating the skin on the outside, surely some of that manipulation or stimulation, if you will also be sort of translated or communicated to the rest of the internal tissues. That was I think it was a simple idea at that time, but I'm not sure 20 years ago we could have executed and developed a product to be able to do that. Because we didn't have enough of the science yet, we didn't have enough of the engineering yet, and we didn't have enough of the technology. Okay, so these were the three elements that we have to bring together to be able to achieve this objective, and that is to both bring beauty and wellness benefits together into one product. So that's the genesis
about it. Yeah. When you talk about it, I just think, I've done enough scans, and that some people may not know about the biophotonic scanner, but it measures your antioxidant levels and kind of gives you a good picture of overall health. And someone can walk in a room and I know if they're going to have a low scan score. I can just look at their skin and this is not a healthy person. And then someone else will walk in and they're glowing and I'm like, oh, yeah, that's a healthy person.
Yeah. So, and then there you go. It's very visual and it's very sort of indicative of the overall wellness or well-being that you have inside your body by just a reflection of the skin. So, let me bring up some slides and share with you. I think that might trigger some of the message points that I think that could be very useful to you. So share screen, share this. Can you see it?
Yeah, we see, yeah, now we're seeing all the slides.
Okay, I'm going to bring up one slide at a time, put it on a projection mode. Okay,
Perfect.
so anyway, so this is the device that we're going to talk about that's shown on this particular slide. It's called the WellSpa. Many of you, if not all of you, have seen it, but I'm going to give you some background behind it and why we're so excited initially about the science and the benefits that it can confer by using this particular device. And I think you're going to find it when you use it, that those benefits are truly meaningful. But we are now the number one for intents and purposes, right? There was another notion when we look at it. Over the years, we have developed the galvanic, the Lumi Spa, the Boost, and so on. We have several devices, including actually the biophotonic scanner. But when I look at all these devices, it's either very much focused on the face, on the skincare side, or is a measurement tool like we have in the biophotonic scanner. They're all very useful. And indeed, you know, when you look at what we have become the number one world beauty device systems company. And it has brought more importantly to me is that with the development of these devices, it gave us a lot of data and insights in terms of what we should be doing next. And that's one thing, when you combine all that data together, that's also contributed to the development of the WellSpa. On the science side, this is where it sort of really dawned on us, right? And I already hinted at this, and that is when you manipulate the skin, you're also manipulating a network of vessels that are very closely connected to the skin. All right. And this network is called the lymphatic system. Okay. Now, why is it so important, the lymphatic system? Well, when you look at the lymphatic system, in terms of its distribution around the body, is actually 3 times wider, and there are more lymphatic vessels than blood vessels, for example. All right. The pink, as shown on this particular slide, is the blood circulatory system. The green is the lymphatic system, and it's much wider than the blood system. Now, there's another very significant difference between the two. We know that the blood can only circulate throughout the body with the help of what we call a pump. And the pump is the heart. We all appreciate very quickly that if that pump, the so-called heart, stops, the blood stops circulating, right? And for intents and purposes, within a few minutes or within some minutes and so on, the whole body shuts down. So it's very, very important for that heart to continue to pump the blood throughout the body, which means what that translates to is the fact that regardless of whether you're sitting down or standing up or lying down, it really doesn't matter the position of the body. The blood will circulate actively throughout the body. So that's how the blood circulation works. By contrast, on the other end, when you look at this schematic, you notice that the lymphatic system lacks a pump. It cannot pump on its own. Okay, so it requires some other means to actually help the lymphatic fluid to move throughout the body. And why is that important? Because it's actually underappreciated, the fact that the lymphatic system, for all intents and purposes, is actually your sewage system in the body. It is critical for that lymphatic fluid to move, to eliminate any toxic metabolites that are being produced during the functioning of your body, because invariably the body is really not very different from a I guess a car engine, for example, as an example. You breathe in the oxygen, and the oxygen or the food that you take and so on, and all of that is being converted to energy to drive the body or to help the body to function. Now, that particular metabolism, in aggregate, we call it body metabolism. That metabolism is not 100% efficient. As it functions and as it proceeds, it will generate some natural toxic metabolites. And those metabolites have got to be excreted from the body constantly. That's why you have the kidneys, right? We all appreciate the fact that if our kidneys are not working very well, those patients will have to go for dialysis. If you stop and ask yourself the question, what's the purpose of the dialysis? It's really to remove all these toxic metabolites I've been talking about from the blood, and you run it through and you take it out because the kidneys are not functioning. But that's the end stage. That's the end of the whole elimination process, if you will. The beginning of that process starts with the lymphatic system. It collects these toxic metabolites. It is an intimate communication with the blood, and eventually it will then be excreted by the kidneys. So we were thinking that if you have something that can help the lymphatic system to move well, you will have an opportunity and a possibility to purify the body, to help the body to really go through and enhance its purification system.
Well, one of the things that I learned from you recently, Joe, was that the only way to do this, other than, I used to get lymphatic massage every week when I lived in Utah. Once Jeff was diagnosed with cancer, we got lymphatic massage. But what I learned from you, and it makes sense now, because I was like, humans have been around for millennia. What did we do before? And what I learned from you was that muscle contraction helps with that. Right. And so, but that's the only natural way to do it is through muscle contraction. And we obviously just don't move our muscles like we used to when we were nomadic and walked everywhere and we're constantly hunting. And so it makes sense that now our bodies just aren't equipped to be as stationary as we are.
Right. Yeah. So I mean, a good illustration of that phenomenon is when you get onto a plane for a 6-hour flight. And eventually, I mean, if you take your shoes off and then before you land, you put your shoes back on, you're going to find it a bit more difficult to shove your feet back into those shoes, right? Because your feet have swollen. Okay. And that is the direct result of the lymphatic fluid, coming out from the vessels and pulling around your feet and your ankles. So that's what happened, because you're not moving your muscles, as you indicated, Diana. And because of the lack of muscle contraction, especially in the lower limbs, your fluid cannot go up to your chest. As shown in this particular slide here, this diagram of a person, the major reservoirs of this fluid, they all have to come back to around the chest area. There are two very important lymph nodes, we call them, on both sides of the chest, and those lymph nodes act like reservoirs to collect the fluid, process them before they get dissipated out again, or on the other side to eventually land in the kidneys. Okay, so that's really, when you're standing up or sitting down, you can imagine gravity is going to pull the fluid down, and if you don't exercise your muscles and so on, it will not be able to. The fluid would not be able to move, and therefore you have some edema forming. All right, so that's a little bit. So this is really a confirmation of what we just talked about. As you move your calf muscles and so on, that's when it contracts that lymphatic line, as you see here, this lymphatic vessel, and therefore as it squeezes the muscle, it will start moving the fluid upwards towards the chest area, right? And that's why it's so important to be able to, that's the only way that the lymphatic fluid can move, right? Especially when you're standing up. And sitting down in front of a computer and not moving, that most of us, I have that kind of sedentary jobs or work that we do that will also contribute to some edema formation.
Definitely, even as, I mean, Jeff and I are active people, but we still were getting weekly lymphatic massage just to move that fluid because it still doesn't always move efficiently. So
not efficient enough, no doubt. So, all right. So that's really what it is all about. So how do we help the lymphatic fluid to move better regardless of what we do? All right. And how we work and how we function. And that's where we came up with this idea of the WellSpa. And this idea is really interesting. I've magnified these so-called metallic nodes here. There are 4 of them at the bottom of this device, okay? And you notice the design, and this is where the engineering, our engineers came into play here. And that is the shape of this particular metallic node is critical to have this device to be in constant contact with the skin. All right. And I'll tell you in a minute why that is so important. Because when we look at our skin, especially this is a body kind of a device and not just for the face, depending on the location of where you're using the device, these metallic nodes, we call them, will help because the skin is actually undulating. It's not absolutely level, okay, and smooth. So as you move the device, you're going to compress the muscle and so on and the skin. And if you have a flat surface, it's not going to be as efficient to keep in contact. All right. So I'll go into that a little bit, why that constant contact is so important. But fundamentally, this particular device will give you 3 overall, depending on the markets and so on. But nonetheless, if you aggregate the benefits, both the beauty and wellness type of benefits that can be delivered by this device, it comes out, and I can summarize them under these 3 categories. It will restore the body to a better well-being or wellness state by using it. All right. It will also help to revitalize the skin. And this is where, during the translation, it's important to realize, and because I think there's an unintended consequence here. The word in English, revitalize, some people may be associating it with the rest of the body as well, but we are really trying to group those skin benefits together under one umbrella, and that is under the revitalized umbrella. Okay, you're going to look better, your body is going to shape better, and so on and so forth. So all those skin benefits, cellulite and whatever that you can see on the skin, will actually be grouped and categorized under this umbrella called the revitalized benefit, right? And then there's another one, it's called refresh in certain markets, it's called recover in certain markets. We just want to make sure that you understand that this particular benefits is very much associated with activity. And that is to help your body to, during a pre-workout or post-workout, that you need to use this device, because I think it will help you to have a better and more effective workout if you use it before the workout. But if you use it after the workout, it will help you to recover quicker. You cool down, you use the device, and it will help you to have a way more, the outcome of the workout would be better enhanced and accelerated in the presence of this particular device. So
and just, I want to interject real quickly out of respect for our friends at the FDA that this is primarily for markets outside of the US, the language we're using, and the name in the US will not be WellSpa, and we're not yet approved. So if you are in the US, please do not share pictures, do not put anything on social media. We really want to respect the process of getting this approved so that we have it, since we haven't had a body type spa in forever in the US.
Yeah.
So just know that this is a global, like we're talking to many different markets. The US, please, please, please don't share this yet. Do not call it a well spa, and don't make any.
Great reminder, Diana, on this one, on this particular point. Yeah, because yeah, it is undergoing FDA review right now, and hopefully, you know, we'll hear from the FDA very soon. Okay.
Thank you.
All right. Great reminder. Okay, so this is, and again, this reminds me that we used to have, and perhaps some of you may remember and recall, a device that we called the body spa several years ago. I think there's a huge difference, right? In fact, I would imagine this is not just an upgrade of that body spa. This is an entirely different type of device that we have developed here. And it's because of these three important things. The design, I've already mentioned to you, those metallic nodes. That's a unique design, and it brings, it's just, we actually learned from the previous body spa, and that is a flat surface. No matter how you make it to look like a sneaker sole or something, it really doesn't matter. It's still flat. It's difficult to achieve the constant contact we need for the microcurrent technology. And the second point is that this microcurrent technology that we have developed, we also learned that we can actually adjust it because of all the sensors, progress and advances we have in those areas, that we can actually have it adjust in such a manner that it will bring a new level of comfort to this particular device as the microcurrent travels across the skin and to achieve its benefits, right? And then finally, last but not least, the third feature is I'll talk about those topical gels that we are launching together with this particular device. Those gels are truly unique and proprietary to us, and it will enhance and maximize the benefits because there are active ingredients in those gels that you can't find anywhere else. So here's the design on the engineering piece. I already mentioned about those metallic nodes at the bottom here, but importantly too, this big handle, or whatever you like to call it, we felt that the previous one, without this particular handle, the way that it's designed, the challenge would be that once you use the gels together with the device, that it's going to become slippery and you might drop it. So it really, when you hold it on this particular handle here, you'll find there's a comfortable feel, and you don't have a sense that that device will slip out from your hands and so on. So we feel that this particular grip design has been optimized, you know, for you to use it, because especially the gels, we sort of the reality is when you use gels, some of it will get onto your hands and so on anyway, and it becomes a bit of a challenge to hold on if you don't have something that looks like that. So the microcurrents is interesting, and this is where we're calling this the continuous comfort control, because it adjusts constantly. In fact, it adjusts more than 80 times a second and so on. And what we find, there is a particular microcurrent range we have to be within to achieve the benefit, to stimulate the skin. All right, it cannot get out of it. And this is where the constant contact with the skin, or connection to the skin, is important, because once, without you sort of recognizing it or feeling it, if you lift it a little bit, the device will automatically adjust to increase the current, because when you lift it, invariably the current will drop, right? So we have a sense to say, hey, for that particular second or whatever, if it's not in contact with the skin, let's increase the current a little bit so that it can be maintained within the effective range. That's what happens, right? But we don't want to increase it too much, because then you sort of, you know, some people with more sensitive skin will sort of feel a little tingling sensation and so on. And We don't want that to happen. So it will constantly adjust. This microcurrent technology is very different from what we had done before with the galvanic current and so on. And it's important for stimulating the skin. And now, in order for you, before I do that, in order for you to conduct this microcurrent, that's where the gel comes in, right? The current will not travel and stimulate the skin on dry skin. It has to have some gel to help it to complete the circuit, if you will. And therefore the gel is pretty critical. And that's why sometimes I think when you use it, you might feel a little bit of tingling sensation when the gel dries, and that's because of that difference in current on dry skin versus wet skin. So
And is there any harm in that, Joe?
not really. It's just a signal that you have to use more gel to achieve those benefits. There's no harm. It's really just a tingling sensation. It's just like, you know, some people with sensitive skin will start to feel it, but immediately that that device will adjust itself to eliminate that tingling.
And I'm sort of a more is more person, so I like to use it really hard. Is that a problem?
You need to really bruise yourself with the device, Diana. Yeah, you should use it in constant contact, but really, I don't think you need to.
It doesn't make a difference if I go really deep, or I mean, I'm really
really,
pushing,
not
it's okay, or
Yeah.
not.
But it's unique. Once again, this is a patented microcurrent.